The effect of antenatal education on mother's choice of pain management method in various stages of labor. Tracy Ader, Kelly Cannon, Wendy Cheatham, Cynthia Mathews, Jerry McHale, student nurses from Cedar Crest College.
This poster represents the synthesis of 5 research articles regarding the antenatal education of laboring mothers. First, the authors synthesized the data in regards to mothers' level of education and knowledge on the options of pain management. And next, the information was synthesized, and following was the recommendations for practice, and lastly, the implementation for nursing practices.
The significance of the problem shows that labor pain relief should be tailored to the women's specific wishes. There's a decreased amount of pain management options knowledgeable to the mother. The information that she usually receives are from sources such as family and friends. This can cause inaccurate information knowledge as well as poorly informed decisions.
The clinical question for this group is, what is the effect of antenatal education on mothers' choice of pain management methods in various stages of labor?
The authors conducted a literature search using 5 databases: CINAHL, HealthSource, Academic Search Premier, Google Scholar, and PubMed. Keywords that were used included antenatal education, labor pain, informed decision-making, and choice. In all cases, the search was limited to scholarly nursing journals, articles published 2007 to the present.
The first research article is a prospective observational quantitative study of 616 women in Vizcaya, Spain. These women were pregnant for the first time with no complications. They either attended no antenatal education classes, 1 to 4 antenatal education classes, or 5 or more antenatal education classes before delivery. Midwives gave the classes based on the Lamaze obstetrics psychoprophylactic method aimed to decrease fear. And the outcomes of the study showed that Spanish women's anxiety level significantly reduced, and compared to the women in the study that did not attend classes, and the experience was not experience-based.
The second research study took place in Hong Kong, China, and it was a randomized controlled trial including 133 women. The experimental group of the study included a 2-session program educational session, and upon the completion of that, there was completion by the mothers of a visual analog scale and a childbirth coping behavior scale. The results of the study concluded that there is an increase in coping mechanism and autonomy of the mother in the labor process, and as well as a decrease in anxiety and pain during early phases of the labor process.
The third study was exploratory and randomized research that was performed in Hong Kong, China. In this case, the purpose was to evaluate the effect of antenatal education on labor experiences in Chinese women. In this case, 40 randomized participants, they complete a questionnaire showing a positive impact of the classes from these participants. From the 40, six participants end up being interviewed. The researchers identify the increase of knowledge of labor of these participants, also facilitating the process of labor, and also a better control for their anxiety.
In the 4th study, a mixed method study in Malawi, 200 pregnant women took a questionnaire. The control group, after taking antenatal education classes, they did not take the antenatal education classes, and the experimental group did. The experimental group showed a 20% increase in knowledge about labor pain and other aspects of the birthing process.
The 5th study was a qualitative study performed in Australia with 25 women who were pregnant with their first baby. The purpose of the study was to determine the amount and quality of knowledge that was obtained about pain relief for labor and delivery by these women. Results indicated that while most of the women considered themselves to be knowledgeable, they were unable to correctly identify risks associated with analgesics. Most participants had utilized a variety of sources to obtain information, but the most common source and the one that was perceived the most reliable was anecdotal information from family and friends.
The nurses' recommendations include the enhancing women's confidence in making choices, also to be culturally sensitive, to offer options for role playing, and as well to create educational sessions for each individual.
As nurses, it is crucial to properly educate mothers on all the available options for labor pain management in a manner that enhances the mother's ability to choose.